Hello, I'm Dr. Sandra Freihofer, Liaison to ACIP, the Advisory Committee on Immunization Practices. Welcome to ACIP's 2021 Adult Immunization Series. The topic, Attention All Subspecialists. The new ACIP Adult Immunization Schedule has a table especially designed for you and your patients. It's Table 2. Millions of adults in the United States have chronic conditions, placing them at increased risk for complications for one or more vaccine-preventable infections. 6 in 10 Americans have one chronic disease. 4 in 10 have at least 2 or more. That usually means they may be seeing at least one subspecialist. Patients with chronic medical conditions are at increased risk of infection. Some of these same patients are also likely to receive most of their care from subspecialists. All these visits with subspecialists can represent missed opportunities for vaccination. You've heard a picture is worth 1,000 words. Here's why we need your help. This graph shows trends in adult vaccination over roughly the last decade. Although there's a minor trend upward, overall things look pretty flat. Subspecialists, your patients need your help. Encourage vaccination. Your recommendation means a lot. Patients trust you. Even better, administer needed vaccines or refer them to someone or someplace that will. And please, when you do vaccinate, be sure to document those vaccinations in your state immunization registry to share the love and avoid duplication. Table 2 of the new adult schedule makes knowing and remembering which vaccines to give easy peasy. Look for yellow, which means vaccination is recommended. Stay clear of those in red, which means not recommended or contraindicated. Orange is pretty intuitive. It means precaution. If the vaccine's in blue, it means shared clinical decision making, and there are only 2, blue, for varicella, for those with HIV and CD4 counts of 200 or more, and also blue for Hep B vaccination for diabetics 60 and older. Blue means you and your patient discuss and decide. Next step, check the vaccine notes. They're in alphabetical order by vaccine type. Need more convincing? Here are some examples. Adults with chronic and immunocompromising health conditions are at substantially increased risk of invasive pneumococcal disease as compared to adults without these conditions. Their disease rates can be up to 20-fold higher. Table 2 indicates the chronic medical conditions and which patients need pneumococcal PPSV23 vaccination. Those with immunocompromising conditions like HIV, asplenia, complement deficiencies, and end-stage renal disease need both pneumococcal vaccines, both PCV13 and PPSV23, but give PCV13 first. Persons living with HIV also need Hep A vaccination. Hep A infection in persons with HIV infection tends to be prolonged, resulting in a higher risk for hepatitis A transmission. Patients with liver disease also need Hep A vaccination, in addition to Hep B and pneumococcal PPSV23 vaccine. Those living with HIV also need vaccination with MenACWY. Their meningitis risk is increased 11 to 24 times. So do those with asplenia and complement component deficiency. In fact, they need both MenACWY and MenB. Those with persistent complement deficiencies have up to a 10,000-fold increased risk for meningococcal disease. They also need a dose of Hib, Haemophilus influenza B vaccine. Check vaccine footnotes for more details. Finally, flu. Adults with chronic medical conditions are significantly more likely to experience serious complications from influenza infection. Studies have also linked flu with increased risk of heart attack. A 2018 study published in the New England Journal of Medicine found that the risk of heart attack was 6 times higher within a week of confirmed flu infection. These findings were most pronounced for older adults and those experiencing their first heart attack. Additionally, a 2020 study published in the Annals of Internal Medicine looked at more than 80,000 U.S. adults hospitalized with flu over 8 flu seasons and found that sudden, serious heart complications were common and occurred in 1 of every 8 patients. I hope these examples give you further insight as to why adult immunization should be addressed by subspecialists. Your patients need and trust you. Help them stay protected by being vaccinated. For the American College of Physicians, I'm Dr. Sandra Freihofer.